I am a sports chiropractor, and I am located in Annandale. I'm going to tell you a little bit about me first before I talk about why I'm even here, talking about form and how it affects your function. So I'm Canadian. I'm from the West Coast. I'm from the Whistler area. So you ask, why am I here? I ask myself that every day, right? But because I was supposed to meet my husband and have 2 children here. That's why. So I'm very happy. But then I moved here and I started racing Xterra. And as I was going through sports chiropractic and active release therapy training, I became really avid off-road triathlete. And trust me, I can't swim like most triathletes. And I fell in love with the sport. I fell in love with my fellow triathletes, and I decided to make my office all about sports injury prevention because it was a passion of mine. So that's sort of how I segued into sports chiropractic. I've been to Xterra World Championships 7 times. I placed 9th, 5th, 5th, 4th, 3rd, 2nd, and then I won. So that was awesome. And then they changed the whole World Championship course off a volcano to roadie type stuff, so you guys would love it now. And very hard now because there's no rocks. Love the rocks. Okay, so my little office has a couple chiropractors, a couple massage therapists, a naturopathic doctor, nutritionist. I work very closely in my community with 1 orthopedist, 1 cardiologist, just because I love having that community feel with networking. And I have a great endurance coach that works in my office as well. There's lots of great coaches in our community. The big thing is to know who you're seeing and to trust that they have your best interests at heart. That's a big point I want to make for you today. But I want to teach you a little bit about what I love, which is anatomy. So your spine is called the axial system. So you got your skull, and then you got your 26 vertebrae that make up your whole spine. Your spine develops from your head down as you develop as a baby up. So as you go from a little baby to crawling, that's when you develop your neck curve into an extension curve. And as you go from crawling to walking, that's when you develop your lower back curve. And those curves are called lordosis in your neck and your lower back. Your mid-back stays curved into flexion. And then we start running, biking, swimming, we crash, cause all these repetitive motion injuries, and then we promptly lose all the curves that we so diligently worked on when we were a child. So the purpose of the curves in the spine are what? What do you think? What do you think you have a curve for? Shock absorption, right? We have to have our coffee, start thinking, and make you think. Okay, so you have the curves to add shock absorption when you're walking, running, jumping, hiking. You lose the curve, you lose the capacity to absorb shock in the body efficiently and effectively. Between each vertebrae, you have like a waterbed disc, and it's 90% water. If you took out a disc and you dissected it, it is 90% or more water composition. The discs are shaped real straight across between the vertebrae. If you have any sort of rotational torsion or a tendency to flex too much with postural stress, you're going to start loading the discs more on one side than the other, and that's where you can start to create a preponderance to disc problems. If you are chronically dehydrated, this is another great tip, how form affects your function. If you're chronically dehydrated, your blood is going to take the water from your discs because your brain needs it more than your spine. But that sets you up for possible spinal degeneration. Chronic dehydration can set you up for spinal degeneration. So I don't want that for you. Okay, your arms and your legs, they're called the appendicular system, and they connect directly to your spine. But it goes from spine to, you've got your clavicle, your scapula, and you got your humerus, 1 bone, you got your ulnar radius, 2 bones, you got a whole bunch of bones that make up your wrist and your hand. And that's the same with your pelvis. You got your hips, you got your femur, 1 bone, patella, then you have your distal leg, 2 bones, tibia and fibula, and you got 26 bones that make up your foot and ankle. The reason why your body's set up like that is awesome. It's to give you that mobility, that agility, and that ability to be very dexterous, to be able to climb or mountain bike, and to have that flexibility of your whole body without creating a lot of stress to your spine. When you crash, which I've done a million times, and you reach out and you land on your arm, that's how your body's designed to take it in your AC joint first, then the clavicle will break before your neck breaks. Like it's a really interesting system how your body's made up. So you should appreciate how amazing the anatomy is, because I love it. So In swimming, it's a very repetitive motion, and so making sure that your appendicular system connects to your spine in a balanced manner can affect how your form is or how your function is in the water after swimming a mile. After that, you can start to create some wear and tear in soft tissue. I want everyone to realize, though, when you're load bearing, your feet are the foundation to your whole alignment. So the form of your foot, how your foot is landing, whether you have really great foot support when you're running, or if you have a very good cleat positioning when you're biking, affects how your leg will rotate when load bearing. So if you have a collapsing arch and maybe you're not aware of it from weakening of the foot or breaking a bone and not having it actively worked on or enough, that arch collapsing, this is a great example of how that can affect your whole pelvis, can create internal rotation of the whole leg. You can sort of understand how collapsing a medial arch in the foot can create more internal rotation of the whole limb, and that can create dropping of the hip and rotation of the whole leg, which can lead to friction on the outside of the leg on the muscle called the iliotibial band. Everyone's heard of that guy. At least half of us have all had IT band syndrome. And I'll get to more to that in a second. But this is a great picture I got out of an orthopedic website where it just was explaining how an arch dropping creates internal rotation of the whole leg. It affects your whole body. Now try running on that arch for 5 years and see how that affects you. Yeah, some things you can do to avoid this sort of thing. Once you're aware of having a sort of a foot issue, consider getting orthotics. There's awesome orthotics, and then there's not so awesome orthotics. I vote for soft, flexible orthotics to enhance the 3 arches that make up your foot. I'm not a proponent of hard plastic orthotics unless you have a really super duper high arch. But some people would just benefit from a super foot, which you get too, so it's super feet. And it's not a custom orthotic, but it's still an excellent support for the 3 arches that make up your foot. And it's not designed for your foot specifically, but it gives you more than what a shoe would. Stretching your calves. Calves are one of the most avoided or neglected muscle in an athlete's body. It originates on your femur and it inserts on the bottom of your heel. So not only is it a knee flexor, but it's also a foot plantar flexor. So therefore, it affects your hamstring, it affects your Achilles tendon, because that's its insertion tendon. It affects directly your plantar fascia. So we spend all this time stretching our hamstrings and our hips, but how often do we spend focusing on our calves? Not often enough. And so a great tip for you guys, and pass it on to all our fellow athletes out there, is when you stretch your calf, you have to stretch it 2 ways, each calf. One with your knee straight, because that's going to get the part of the calf that goes up into the hamstring. So off a stair ideally, or with your knee straight, and then with your knee bent, because that'll take the load off the upper part of the calf and it goes right down into your soleus, into the Achilles, into the plantar arch. Knee straight, knee bent. Get the whole calf. And I recommend all of you, me, all of us, you should all stretch your calf every day, a couple times a day. When you hit a stair, like take a minute, 30 seconds one side, and then 30 seconds the other. And you might just avoid something that might be starting up in the name of plantar fasciitis or Achilles tendonitis. Who stretches calves here? Great, 35%. Not bad. So, my coach made me start doing this before I swam because I always get shoulder pain when I swim, and wow, my shoulder pain went away. So I did some research. I found out that we all sit, most of us sit for a living, and most of us travel, some of us travel, and a lot of that involves forward rotation of your shoulders. Your rotator cuff on the back of the shoulder are external rotators, so they do this. And with swimming, it's all internal rotation. It's lats and pecs. And so it's further stretching of the back of the rotator cuff. So you can just warm those external rotators up a little bit because they're already stretched out and weak. And most of us, like if you were to do an external rotation exercise with a light dumbbell, you'll fatigue, I don't care how strong you are, you'll fatigue out at 8 to 10 reps using a 10-pound dumbbell. 10 pounds doesn't sound like much, but for these little muscles, which are a major shoulder stabilizer, it's a lot. So I would recommend that we all do a little bit of external rotation with your knee, your elbow bent to 90 degrees with a light dumbbell, just to activate the posterior part of the shoulder rotator cuff, which again, we're neglecting just sitting here. Your shoulders are like, a little stretched out. And that can start to prevent any issues you might be developing in your swimming, if you feel shoulder pain in your swim. But windmills are simple, easy. It just opens up the way the humeral head, the humerus, attaches to your scapula. It opens up the cartilage, and it just brings a little bit of blood flow in there before you jump in. Even if you're just doing your warm-up first, it will break that tendency of your internal rotators to override your external rotators. So I feel like I look like an idiot standing there, but then I notice other people are doing it. I'm like, okay, good. Yes, another thing I can recommend, and this is more for your spine, is to flex and extend your back a little bit before you get in the water. Some people come into me with lower back pain with swimming, and it's not the fact that they're swimming that's causing the lower back pain, it's they're getting in the water with a tight spine. Because this is what we do. Work, work, work. Ding! I got exactly 55 minutes to get my workout in. And you jump in the water, you're like, okay, that's a 45-minute swim. And there's no warming up to your lower back. So you went from a static, sitting, loading position to your workout. So just flex, extend before you swim. And that in itself, that little 30 seconds both ways, can open up your discs both ways and can create a little bit of a blood flow into your spine. That is not me swimming, by the way. I do not look that good. Okay, so who here is a mountain biker? Oh, hey, good people in here. Okay, where's Ann Mater? There she is. Okay, so there's a difference between the wear and tear you develop in your body from road riding to mountain biking. Mountain biking, there's a lot of, you're getting off the seat, there's a lot of movement in your body, the terrain is a lot softer, the dirt's a lot softer when you hit it, and in road riding, there's a lot more repetitive motion in one position. But one thing is for sure, no matter what bike you ride, is your seat position or your bike position can play havoc on your spine. And some things I see with athletes, cyclists, is if their seat's too high, too low, lower back pain, hip pain. If their cleat position's too far forward, too far back, numbness in their feet, that can radiate up into the calf. Overcompensating with the hip if the seat's off too, if the seat height's off. Handlebar positioning. So my point is having a good bike fit and having your bike fit, every time you get a new bike, don't assume it's going to be set up for you. You must always get your bike fit to prevent spinal problems, pain, muscle spasm, and overuse. I did a mountain bike race last September. My seat was too high because I just bought the bike because I broke my other bike, and I didn't realize my seat was too high, and I went, damn it, I'm at the race anyway, I'm going to race it. So I raced with the seat too high. I'm like, is this good stretch to my back? Well, then I could not walk for a week. Yes. So don't do that. Get your bike fit, and I refer to the bike lane. And they're today in their tents next to my tent, and they're discussing, well, how does bike fit affect your body? So I can encourage you to seek people like them to discuss your bike, whether it's a tri-bike, road bike, or mountain bike. Of course, mountain bike is my thing. If you want to talk mountain bike, anytime. Okay, so running. Trail running, road running, it all has an impact on the body, but studies are showing that if you run on hard terrain, concrete or pavement, you have 3 times an increased chance of developing repetitive motion injuries such as Achilles tendonitis, IT band syndrome in the knee, shin splints, and even lower back pain. However, if you trail run, you have 20 times the chance of tripping and breaking your hands. So, I'm kidding. It's only like 5 times. But how you run, your form while running is key as well. Everyone agrees that there's a right way and a wrong way to run, right? So finding the right coach to teach you how to run properly is important. You got to have someone that you can relate to, communicate with. But heel striking is absolutely the only thing you use when you go down a hill so you don't run into something. Slow yourself down. But forefoot landing means not tippy toes, but anything just in front of the heel. And I have an x-ray of a foot. I'll show you why in a second. Minimalist shoes, by the way, I love them for some people, but it takes a long time to develop the integrity of the arches of the foot, the plantar fascia, and the Achilles in the bottom of your leg to strengthen and develop an integrity and endurance in those propulsive muscles. It takes a while to develop. It's completely different to running with a normal trail shoe or a road shoe. Does anyone here run in minimalist shoes? A couple of you? All right. So this is just a picture of 3 types of arches. On the far right is someone's foot that's completely collapsing. There's 3 arches in the foot. You have the medial longitudinal arch, which is on the inside, that goes from your heel bone to your big toe. You have the lateral longitudinal arch that goes from your heel to your pinky toe, and then the transverse metatarsal arch that goes right across. When you start to collapse an arch, whether it's from an injury or repetitive motion or a dropped hip, that's what your foot will look like. And actually, we're doing foot scans. If you want to see what your foot looks like, we're doing scans of people's feet today. But with a foot that looks like that, that can develop a lot of Achilles issues, plantar issues, and I would say that's a person that might want and benefit from a custom full-length orthotic that would go into a shoe. Someone with a middle, that looks fantastic. That's actually an ideal. Actually, even better would be if there's nothing in the middle with the same, no pressure in the middle of that lateral longitudinal arch. But a little bit's okay, and I would say someone with that kind of foot would be good with a super feet type of orthotic or a very supportive shoe in between the minimalist shoes if you're a minimalist runner. The impression of the foot on the far left is somebody who has a super duper high medial arch, and those are the people that I would say would benefit from a harder orthotic to maintain the integrity of that medial longitudinal arch. A soft orthotic would not help that person. And you can see that picture on the left there with without orthotic. It does just show you how it supports slightly how the calcaneus sits, which would directly impact the 3 arches that attach to the heel bone. So your iliotibial band originates on the ilium, which is your hip bone, and inserts below the knee on the fibula, the tibia, and the lateral meniscus in the knee. This is one of the primary hip and knee stabilizers when in locomotion. It's one of the primary muscles that help support your knee so it doesn't over-rotate to protect the meniscus between the femur and the tibia. Very often when we're running, we have a preponderance to over-pronate. 83% of runners over-pronate. Doesn't mean 83% of runners have injuries because of it, because there's all that compensating that can happen. But we do have a preponderance to over-pronate, and that can create an over-lengthening of the iliotibial band from its origin on your hip to its insertion below the knee. And there's 2 bones that stick out on your femur. Here it's called the greater trochanter. Here it's just a condyle, and instead of the IT band passing freely over it as it's supporting your hip and knee, it's overstretched and it'll start to friction. And you'll all of a sudden feel like a stabbing pain, one or the other. On the hip, it would be more of a bursitis because there's a bursa underneath the tibia, underneath the IT band at that point. But if it's overstretched, it will friction. And that can be avoided by IT band stretching, foam roller massage on that length of tissue, because it's a muscle in the hip and it's a tendon down the side of the femur. Who here has a foam roller? Fantastic. Who here uses it? Oh yeah, because you are a special group of people. So, any question on the IT band while I'm here, actually? Because this is a biggie, and it can, okay, good. So your foot, that's what your foot kind of looks like. There's 26 bones that make up your foot and ankle, and you have all these bones for shock absorption and mobility, and to give you the capacity to pivot and to push off without creating undue strain and shock into the body, into the tibia. Things you can do to prevent injuries in your foot and a plantar arch as well as the Achilles, because they coincide right behind the heel bone, is massage your foot on a golf ball. Just have a golf ball. I know no one here golfs, right? Haven't had my second latte yet, so I can't be held responsible for anything I say about golfing. Okay, so you can do golf ball massage from your heel bone all the way to your toes, gently. You don't want to go too hard because there's not much meat there, and the bones are right underneath, right above the thin muscle. But that can help prevent any kind of adhesion breaking or developing between the bones and limiting the range of motion between those bones. Stretch, I told you about the calf muscle. Stretch off the edge of a stair, knee straight, knee bent, 30 seconds. Just do that as a proactive way of preventing calf problems, hamstring problems because the calf works with the hamstring and the calf works with the foot. You can take your toes. This is a great one. Take your toes and stretch them back and forth. Feels great. And what you're doing is you're separating the little muscles between the bones called interossei. And you can just open up the joints of your foot. It's tremendous at actually offsetting foot cramps and plantar tightening. Or get someone else to do it. It's even better. Towel scrunch. That's where you put a little towel on the ground. You put your toes on the tip of the towel and you start to pull it back. This is more of a strengthening exercise to develop the integrity of the muscles above the arches. Alphabets. If you ever sprain your ankle or have some edema in your ankle, swelling, first thing in the morning, lift your foot up and spell the letters of the alphabet, A, B, C, and so on. And that can open up and increase the range of motion of your ankle before you get load bearing. It's a great rehab technique, spelling the alphabet with your feet, excellent for your ankle integrity. And wobble board, very hard. Have a wall next to you because I almost die every time I get on that thing. And that's great to develop a neuro development between your feet and your brain. The wobble board is fantastic for ankles. You don't have to wait till you're injured or weak to use the wobble board. If you're ever in the gym, just throw on a wobble board for like a minute. It goes a long way. So this is what the foot looks like on the side view of an x-ray. And I wanted you to see this because this is why it's so important to run forefoot and not heel plant when you're running. So this is your calcaneus, your heel bone. There's no shock absorbing capacity in your heel bone. It's one bone. And then if you land on your heel over and over again, it's just going to go straight up the tibia, into the lateral knee, into the femur, into the hip. This is where all the arches attach, on the front of the calcaneus, and they insert way up here. So you have this whole length of foot to absorb all the shock in between the joints of the feet. And hence, forefoot landing is efficient. It'll make you faster because you're now landing underneath your body and not in front of your body. And you're not going to absorb a lot of shock into the heel, into the lower extremity. I'm heel striking. Do not do what I do. Okay. Just a quick picture of your knee. You have two meniscus that separate your femur from your tibia. Those are the load-bearing bones, your femur and then your tibia. And the meniscus in your leg and your knee are flat and evenly shaped on either side. I want you to see that because if you have extra rotation or torsional stress in your knee because of a dropping of a hip or a flattening of an arch, or you have a pebble in your shoe and you're running to, because of antalgia, taking pain away off the other foot, you will start to rotate the femur harder on one side or the other, and that can develop arthritic change in the meniscus. So this is another example of how your form can prevent knee injuries. And these are simple things you can do by maintaining good alignment, flexibility, hydration in your body. This is, now I'm going to the spine. Is your neck supposed to be extended or flexed if it's healthy? Extended, guys. I already went over this. Okay, so your neck grows into an extension curve when you start crawling and lift your head up. So that's a very, very normal development pattern that happens in your spine, and it mirrors the development of the nervous system. The purpose of your spine is to protect, of course, your nervous system. If you take a healthy curve that's into extension and you flex it forward, you're going to directly impact the integrity of the nervous system, as well as all the muscles that connect, in the case of the neck, that connect your arms to your spine. So you have your trapezius, you have your levator scapulae, you have all these muscles that connect your spine to your extremities. You take the curve and you change it, it's going to affect your balance and how strong you are from one side to the other, your ability to swim with an even stroke, your ability to run with a nice natural gait with your shoulders relaxed. Another thing that happens when you have a slow postural shift into flexion, which can be caused, by the way, by chronic postural stress, how you sit at work, how you sit as a student, how you sit on the bike. It can happen from whiplash, rear-ended, car accidents can result in a forward flex position, or blunt trauma. Mountain biking, fall off, hit a tree. Those are the things that can create this kind of positioning of your neck. Yes, there's lots of things you can do to regain a healthy curve in your neck. Otherwise, I'd be like this. So I have literally hit more trees than anyone in this room. Okay, A chronic forward flexed neck can lead to degeneration. I just know most people have never seen what a bone spur looks like, but it's actually bone on bone. Calcium starts to layer down on the front or back or on the sides of a vertebrae, and once you have a bone spur, there's not much you can do proactively to take it away. Like chiropractic won't take that away, exercise really won't, but there's a lot of things you can do to prevent it from getting worse. It will also cause narrowing of the disc space between the vertebrae. The space between the vertebrae, all of them should be evenly stacked between all the bones. That chronically being said, with that posture, slow wear and tear, can lead to fusion of the spine. Where the body keeps laying down calcium, movement is the key to life. If you stop moving a joint, it starts to stiffen up. And if you can avoid fusion, that's the best thing you can do for yourself, because range of motion is key to circulation, innervation, and balance. So that's just what it looks like to have that bone spurring happening from one bone to the other. So far, any questions? Good. All right. So some tips for you. Okay. I recommend for soft tissue injuries to seek an active release therapy certified provider. There are massage therapists who are ART certified. There are physical therapists who are ART certified, and there are chiropractors who are ART certified. Active release therapy is a movement-based massage technique that's designed to break up adhesion in soft tissue, whether it's muscle, tendon, ligament, or that can lead to nerve entrapment. When a nerve is entrapped by soft tissue, then it doesn't floss through the soft tissue with your movements, and you start to feel burning, numbness, tingling. Those are symptoms of nerve entrapment. It's, as I said, it's a movement-based massage technique, and the patient is active with the physician. So you're moving a tissue while the doctor is holding on to the area of adhesion and helping break down scar tissue. Scar tissue is not flexible, and it's 20% weaker than the original tissue, so it's vulnerable to re-breaking when you go back into your sport. If you are injured and you're seeking a physical therapist, a chiropractor, or a massage therapist, seek somebody who can speak your language as an athlete. My ex-boyfriend, long time ago, was a chiropractor who told me I should not run anymore because I had IT band syndrome. I'm like, gotta break up with you. So, like seriously, he's out there telling people to stop running. And there's gonna be people like that who just don't understand, and they're sincere, and they mean well, but try to find somebody who's gonna help you regain your sport back and tell you how to train back into your sport safely. Who knows good coaches, who knows good orthopedists, for example. Somebody who's works hard in your community. As a proactive, I endorse massage therapy once a month, but at least get a massage after hard workouts or a really big race or a race at all, so that you are starting to recover effectively. It's almost like active recovery for your next set of workouts. So I try to get a massage once every 4 to 6 weeks. I try. Foam roller. As we talked, a lot of you have foam roller and use it. If you can't get to an area with a foam roller like the upper back, consider tennis ball. But the main thing is you want to be rolling over something like that to help bring blood flow into an area that's starting to tighten up. You can do that even if you're not injured. I think everyone here should be foam rollering their IT bands 2-3 times a week. How long do you do it for? I would say no more than 4 or 5 minutes each leg. But go all the way from the hip down to the knee, and then end going knee to the hip. Always end up going towards the heart and lung. If you're ever doing self-massage, or you're getting massaged, or you're using a foam roller, always work towards the heart and lung, not away from it, so that you're assisting your venous and lymphatic system. Athletes, we're all talking about protein, carbohydrate, and what's a great ratio, how to recover from workouts, what to drink. So I'm going to tell you, don't forget fruit and vegetables. Do you get fruit with your breakfast? Do you get veggies with your lunch? Are they raw? Are they organic? Your food is your medicine. Hippocrates said it, so it must be true. And we're not getting enough of our vitamins and minerals from natural sources. I can highly endorse you all to have more fruit, more vegetable into your diet. And of course, water. I didn't mention that here, but by being chronically dehydrated, which means drinking anything less than 64 ounces in a day, can lead to spinal degeneration, can lead to joint degeneration, and just makes you sluggish and slower if you want to look at your ego. So your body should be 80 to 90% hydrated, and taking that out can really limit your capacity as a human being. Okay, sleeping. Who sleeps 8 hours a night? Nobody, because we live here. In an ideal world, okay, you should actually sleep 8 hours a night. So that's where you recover. There's an actual release in the brain of the growth hormone where it helps you recover from all your workouts, makes you heal and recover and be ready for your next week of workouts. But, so sleep, we'll just delete that one from here. And everyone should be stretching about 10 minutes a day, but at least a couple days a week on all the key muscles that you're working that week. So if you're doing a lot of swimming, lats, pecs, neck, if you're doing a lot of running that week, legs, IT bands, hips, hip flexors, and the one muscle that we all forget, calves. Don't forget your calves. One thing I tell my patients, if you get injured, if your IT band, say, is injured, and you get active release therapy on that tissue and you're working it on the foam roller, then you need to stretch the tissue that you've injured 4 times a day for 30 seconds twice. So 4 times a day, stretch the tissue gently, because sometimes you can overstretch. Hit it twice, do the other side twice, and then ideally ice for 5 to 10 minutes on that area. So you're opening up the fascia, then you're shutting down the inflammation. Opening up the fascia, shutting down the inflammation. And that'll help you restore your range of motion in that area, that global area. Okay, and I think that's all I've got, but I can talk about anything. As I said, movement is the key to health and circulation and longevity in your sport. And don't let anyone tell you to quit your sport because you're injured. Find somebody who can help you regain your activity effectively and as quickly as possible. Any questions? Yes? Fantastic. So foam roller exercises you can do on your side, and I can't demo it right here, I don't have one, but you can do the whole IT band, you can do the hamstring, the quadricep, you can lay on the floor and do your lower back a little bit. I put the foam roller on the wall and I'll do my mid back, leaning against the wall, sort of like a wall squat. And you can do little lats. For the back of the shoulder, you'll have to use a tennis ball. But you know what, if you Google foam roller exercises, they got pictures, excellent explanations. Any questions on chiropractic? Or yes?
Along the lines of the foam rollers, have you seen those, I think they're called rumble rollers, or even I've heard some people use PVC pipe.
Yeah.
I think that may be too hard.
Yeah, the foam roller is designed, I would just use a foam roller if your intent is to self-massage, because you can bruise your muscle if you go a little too hard of a surface. And they really made the foam roller the perfect density to be effective without, I mean, you can get on a foam roller and bruise yourself. So support yourself so that when you first do it, it's going to be like, oh my God, what's she talking about? It's like torture. But then if you just gently work through that area of fascial adhesion and tightness, it will break up and loosen up. And does anyone agree with me here? Does anyone experience that? It gets better. It does. And but just don't overdo it at first. Just like the foot wheel or the golf ball on the foot. Start off slow and then get a little progressively deeper. Yes?
Do you have any tips for sand running?
Sand running. Yeah, you saw my picture of sand running? Yeah. The last 300 yards of XTR World Championships is on a beach. Damn them. So the tip for sand running is go down to right where the water ends before the beach is dry. And that's the ideal place to race. If you're on a race, go to the water. You'll pass 4,000 people. And you can train on the soft part too if you want, but you're really going to be, if you're racing, you're going to go down just north of the water where it's hard but not too sandy, and 4-foot landing, very, very, very short steps. But you got to do a lot of it. The way you train for sand running is you got to get on sand. There's no sand here.
You're leaning forward?
Yes, you're leaning forward, and you're taking real small steps. And it's exhausting, but it's so much easier right where the water ends, right before the sand gets real dry. That is key. It may look like it's a shorter thing to go on the dry sand, but it's faster down there. All right, so awesome. Have an awesome day.